So welcome to our second video tutorial on pain. This one is titled Doctoring the Pain, and in it we're going to be looking at the specific role of a specialist pain medicine physician, and I'm here with Dr. Diarmuid McCoy. Thanks again, Dr. McCoy, for joining us. Let me start by asking you, what is a specialist pain medicine physician?
So here in Australia, the title Specialist Pain Medicine Physician is a protected title. And it is done so to reflect the training, qualifications, and experience that fellows of the Faculty of Pain Medicine at the Australian and New Zealand College of Anaesthetists have when gaining this particular qualification. Doctors coming from a variety of specialists can present for 2 years of intensive, dedicated training in the management of persistent pain, acute pain, cancer pain, and all of the other therapies that go around these particular presentations. There is a rigorous examination in viva and written, and also accumulated continuous assessments with long case analysis before getting the qualification. And it is only those who have the qualification can honestly use the title Specialist Pain Medicine Physician. It is a protected title. The training involves being at a dedicated centre for managing, assessing, and hopefully treating pain in a variety of different presentations.
So what specifically does a specialist pain medicine physician do?
Normally, patients who are referred to a pain physician are those in which the specialist or primary care physician, physiotherapist, or other has been unable to make a lot of progress in managing the persistent pain of that patient and the functional problems that present with them. So we take an approach of the psychosocial biomedical, taking a very wide and comprehensive view of the patient, their pain, how it presents, the patient in their family, in their community, and in their workplace. And taking all of these elements together, if we can make progress in each of these elements, then we can almost certainly make progress with the patient. And this will take the form of psychological intervention, occupational therapy intervention, physiotherapy of various different types, perhaps medication, perhaps intervention or infusions, and probably a combination of all of these things. But it must be done in a multidisciplinary, transdisciplinary fashion with physiotherapists and occupational therapists and psychologists who have experience in the management of patients with this type of pain. The specialist coordinates this and has a reasonably deep understanding of each of these elements. What we would like to see at the conclusion is that the patient would improve not only in a decrease in their pain, but an improvement in their function and a decreased dependency on healthcare professionals.
So why should an individual be referred to a specialist pain medicine physician? And also, is there an appropriate time that the referral should be made?
The definition of persistent pain is a pain that goes on for 3 months or more. Normally, acute pain resolves in a reasonably predictable fashion from days to possibly a week or two. Patients with persistent pain that is going on for longer than expected, interfering with their quality of life, their sleep, their ability to work, their ability to take on activities of daily living or look after themselves, obviously needs a more intensive, broader and deeper examination of how we might improve their function. And that's when referral to a specialist pain medicine physician is appropriate. They can take the psychosocial biomedical approach, measure their pain in specific ways and use various different techniques, helped by allies in allied health and other specialties to improve the patient's function. The optimal time is probably before it becomes entrenched in their central nervous system and in their attitude. This is always a difficult one to estimate, but the earlier that we see them, the greater chance of success in improving their pain, improving their function, and improving their quality of life.
And when we think about the personal injury sector, on what kinds of occasions and for what particular purposes would an injured individual be referred to a specialist pain medicine physician?
The situation with workers who are injured or accident victims from road traffic accidents is that the majority of those who are injured happily recover in a reasonable time. Some are so badly injured that they fall into a different category. The small percentage, therefore, that are likely to develop persistent pain are those who we would like to see at an earliest stage. And within 3 to 6 months of their injury is probably the optimal time. When it goes to 12 months, 18 months, and out to 24 months, it becomes more difficult. Not impossible, but certainly more difficult to improve them and get them back to work. It may be necessary to consider other forms of work, and we can help out with advising on occupational therapy. It may be that the type of physiotherapy that they need is more specific, and we can help out on advising in that direction also. Treatment such as medication, infusions, or interventions would also be in the realm of what we can offer, and earlier the better. In recent years, there has been more emphasis on getting the opinions of various different medical specialties involved in the overall assessment and progress of a patient who is injured through work or through an accident. And this is absolutely appropriate. Getting early opinions from a musculoskeletal specialist, a pain specialist, perhaps an orthopedic specialist, and a psychiatrist would all add richness and comprehensive assessment for that patient, and probably progress it quicker with a promise of earlier resolution, better resolution, and improvement in quality of life. And the pain specialist is central to that process.
So thank you, Dr. McCoy, for helping provide additional clarity around the specific role of a specialist pain medicine physician, and also the occasions and the timing around and the role that a specialist pain medicine physician has in terms of from a treatment perspective, but also a personal injury perspective. We're going to move on to looking at special pain, complex regional pain syndrome. So I do hope you'll all come back and join us for our next video tutorial. Thank you.